Hi, my name is Dr. Annie Gaudaparthy. I'm a double board certified adult and child psychiatrist. I wanted to share with y'all what I've seen as a provider, the patterns I've seen. Like I said, I've been in practice since 2013, and 2020, something distinctly was different. In the spring of 2020, as a provider, I told all my patients, stay connected, because the mask, and we were all just trying to make sure everybody was okay. However, the fall of 2020, when everybody returned to school, people's nervous systems were dysregulated. Everybody was in fight or flight. Administration, of course, was probably on a mission to make sure that everybody's learning is in check according to the rules and regulations. Teachers came in, and I had some moms who've been teaching for 20, 30 years who were just like, it was insane. The kids they were seeing in the classroom were very dysregulated emotionally, hyperactive, lashing out, irritable, and it was very chaotic and not appropriate for learning. What I saw in my practice that fall was when kids returned home from school, they were seeking to connect, but again, going back to the ways they were connecting before, whether it's through social media, video games, apps, or like those dopamine stimulating shows. This resulted in this continuous cycle of, after 25 to 30 minutes of that, of again getting irritable, lashing out, avoiding, not wanting to do what needed to be done, and hence we have screen addiction. This cycle, some parents have been aware of it, some it's been really hard to figure out and try to navigate. And the thing I was seeing among my patients was that I'd have a patient doing well and okay on medication, but then they were back to being very impulsive or have ADHD, and I just got so confused. Well, come to find out, it was usually during those breaks, holiday breaks from school, during unstructured time, or that, again, because we're creatures of habit, the environment would get us back into looking at screens. And parents wouldn't know any better. Like when I was growing up, I watched a lot of TV, and I feel like that TV is very different from today's world of TV. So come to find out, as I reflect and analyze the past 3 to 4 years, I realized that a lot of my families that I work with would send their kids to summer camps, overnight, outdoor summer camps, and they would thrive. What is the common denominator here? No screens. It's quite clear, y'all, we don't need to have some grant or research to know and see that these things are negatively impacting children of all ages. I've also seen people in their teens and 20s trying to connect and trying to seek love and affection, and through virtually or online, and almost being brainwashed into cults, into various things. It's been extremely disheartening to see that all in the name of connection and seeking connection, people have been taken advantage of, manipulated. We've got to get back to the basics of common humanity. We've got to get back to having moral compass, of accountability, of trust, of respect of one another. And the only way that can happen is if there is some connection and community, because that's how we're wired and designed. We're social, emotional beings. In a tech-heavy world, it's not what our brains and our nervous systems are used to. Please, please be intentional and aware of the amount of time you spend on apps, on screens. Please, please be intentional and aware that you're doing the work first, and then you're getting the reward. Even for parents, it's a very tough, difficult thing to navigate. I myself know. But again, I've worked with hundreds and hundreds of families, and it's like the white elephant in the room people aren't talking about. And it definitely needs to be talked about if you care about your child's social emotional well-being and learning. Thanks. Check out our website, www.ccfp.clinic. I know how to help families. I know how to help kids. I am a parent. I have been there. It takes a village. Let me help. Thank you.